Welcome back, everybody, from lunch. I know I appreciated stepping away and stretching my legs and getting something to eat and drink, so welcome back. It's really good to see all of you this morning that were with us and to welcome new people because we know that people change throughout the course of the day. So if you're just joining us now, welcome to the meeting. And if you were with us all morning, welcome back. This afternoon, I'm going to be joined by some of my wonderful colleagues, and together we're going to talk about some of the lessons we have learned in our collaborations with Puerto Rico and the U.S. Virgin Islands and what applications those lessons have for all of us in our own efforts to work with communities and cultural humility. So I'm going to be joined today by NYMAC's Community Engagement Liaison, Maria Isabel Frangenberg, and by Enrique Lopez, Genetic Counselor and the lead of NYMAC's Puerto Rico team, and by Cheyla Clark, Genetic Counselor and the lead of NYMAC's U.S. Virgin Islands team, and by Amanda Bergner, Genetic Counselor and Director of the Genetic Counseling Training Program at Columbia University. You can read more about the backgrounds of these great speakers in their bios on the conference website. Okay. So Amanda discloses the following relevant relationships with ineligible companies. Any potential interests have been mitigated. She's a consultant with UpToDate. And the rest of the speakers do not have any relevant financial disclosures. So during our time together this afternoon, we hope to review again some of NYMAC's key goals in the territories, discuss some relevant cultural concepts, look at how culture, health, and genetics intersect, share some stories and personal reflections from our work, and then pull all of this together. We'll be using small group discussions, some polling, chat questions, and other interactive activities as well. So before we start talking about our experiences, I just want to share my deep gratitude to our partners in the territories. A lot of you met Rosani this morning. She's a wonderful collaborator and partner. None of this would be possible without our territory collaborators, community and family partners, and other collaborating programs. We consider ourselves so very lucky to be in your company and to get to work together. So if you're here with us right now and have worked with us, please feel free to say hi or comment in the chat. I know we saw Jermaine and Dr. Karen Brown this morning from Virgin Islands. We welcome your insights and feedback on this process as we share how we experienced it today. So thank you so much to all of you. So just as a quick refresher, because I know this has been mentioned already today, NYMAC really has three key goals in the territories, which are continually shaped, modified, and influenced by our local teams and communities. The first is to build local teams of stakeholders. The second is to support education needs. And the last is to explore the use of telehealth for genetic services. In doing this work, our experiences put us in the position of going into and experiencing another culture and needing to adapt, which is different than what most of us are used to, where we see people coming into our culture and we're asking them to adapt. Some of the issues noted in our experiences are things that have been described and researched before, but some were new concepts to our team. Having these new experiences and gaining new insights and perspectives really highlighted the importance of cultural humility and dexterity, because our team, who have all received education about culture and diversity, were still surprised and learning a lot of new things through this work. Many of our lessons are gathered from working with communities living outside the mainland US, but lessons are really often applicable to the diverse populations within the mainland also. We want to get a sense of where people are coming from in this group. So we're going to take just 2 minutes together and fill out a quick survey here about cultural competence. You'll see a link for the survey come up in the chat in English and Spanish, so pick which one you are more comfortable with. Go ahead and click on that and give us some information about where you're coming from. We'll play a little nice thinking music for you for just a few minutes while we do that together. Perfect, thanks. So we really appreciate your input on that. And we're actually going to circle back to those questions at the end of our conversation today. So with that, I'm going to pass the baton to my colleague, Maria Isabel Frangenberg.
Thank you, Alissa. Hi.
Oh, you muted yourself, Maria.
There we go. I unmuted myself and I undid what Fred had done. Thank you. Thank you, Alissa, very much. And hi, everyone. It is wonderful to be here. To start, let's see those jazz hands. If you have ever attended a cultural competence workshop or a DEI, diversity, equity, and inclusion workshop, see those jazz hands. Great. Thank you so much. That's a lot of you. Excellent. Thank you. And for those of you who haven't, we will baptize you today. Welcome. I think this will be great. Thank you all. So we need the slides. I'm not seeing the slides on. Is it my view or what is happening? Thank you. Excellent. Excellent. Thank you so very much. So we're here to talk about culture today. Culture in our work, culture in our communities, and culture in our lives. But ultimately, we're here to talk about how culture happens in the genetic services realm, whether you're a provider, whether you're a family. Earlier today, I met a pharmacist who wanted to join us today, which is wonderful. Thank you all for being here for every reason that you chose to join us. We have, as Alissa said, a wonderful group of people who traveled to the Virgin Islands and to Puerto Rico, and they practiced their profession, genetics, in a culture that is not the dominant culture of the United States. The experiences, as Alissa mentioned, that we all went through were some were expected, some were very unexpected. So we're here going to share our innermost thoughts about those incredible experiences. Slide, please. But before we delve into culture, let's get a little bit more basic. Let's talk about the here and now, who we are. We are a lot more than language, a lot more than our ethnicities, or where we were born. Go ahead and take a few minutes or a couple minutes really to tell me what makes you you. Do you love to crochet? Do you love to dance? Do you spend a lot of time styling your hair? I know I do, but it's not. It's not because I love to, but because I have to. It has war touched your life in any way, political conflict. So go to the Mentimeter, if you would please, and see how many things you can tell me. I think Fred is going to take us there in just a minute. How many things you can tell me? Pet loving and adventurous. That is great. A runner. Crunchy. I love that. Crunchy. That's a 90s word that I remember with my Birkenstocks that I just bought a new pair not too long ago. Partner, tennis, cooking, runner, pet loving, runner, traveler friend, mother, quirky. I love that. Family oriented, bilingual, and bicultural. I love that. Mountain biking. Tattoo, yay, I love that too. Vegan, I'm trying to get into that as well. Animal lover, a lot of animal lovers here. This is really awesome. Wow, family, tennis, runner, lots of runners, podcast listener. And I know there's a podcast maker somewhere in our midst as well. Hockey player, that's great. Aerial fabrics, awesome. Wow, this is amazing. And it keeps coming. Mama, nature lover. My goodness, I'm having a hard time reading them all now. Friend, I love that. Goofy, immigrant, one here. Funny, active, bilingual again. This is great. Neurodivergent, excellent. Junk journaling, I think I read. And wow, lifelong partner, incredible. Thank you. Let's see, I have a new one here on the chat. Let me read that. Love of books, excellent. Thank you so much for that. Thank you, everyone. So now that we have brought everything. So there is this term that I love, that is intersectionality. All that you have brought into that makes you who you are. We're intersectional at all times. We bring different pieces of who we are to different interactions. Today, the piece I was telling Enrique earlier today and Mabel, the piece that I'm most aware of myself today is my accent. I'm having a bad English day. So please forgive the many faux pas that I will make in the English language today, though I've been speaking it for about 34 years. Okay, thank you very much. So now let's move on to what we promised we would be talking about, and that is culture. And the language around culture evolves constantly. And there are many terms and many concepts that have been advanced throughout a couple or maybe more decades now. But today we're going to focus on 4. 2 that are more personal and 2 that are organizational. For the most part, cultural competence that emphasizes the importance of understanding different cultures. We have cultural humility that emphasizes the importance of being open-minded and learning from others. Cultural dexterity, which involves the ability to adapt to different cultural contexts, while cultural agility requires individuals to be able to navigate complex and rapidly changing cross-cultural environments. Slide, please, but let's move on to each one. Cultural competence. I'm pretty sure that even if you have never attended a workshop, you have heard about this term. And we've been talking about it for a very long time. And it refers to the ability for us to become more understanding of other people's customs, of beliefs, values, practices. And we also want to be able to adapt our behavior to better communicate and work with people from those cultures, right? And this, for example, let me give you an example in our work with Puerto Rico and the Virgin Islands. We needed to become culturally competent in many aspects, but one of them was very important. The people in the Virgin Islands, and I know there's a couple of here with us, love carnivals, and there are many carnivals. And for us to be able to understand when would be the best time to do our work, we needed to understand when those carnivals happened, right? Or we could go against the current and say, oh, no, we're going to come in April, which is carnival month, right? So we needed to understand. That was a little piece of cultural competence. Okay, but then there are other aspects of culture, cultural humility. You're going to see that this is the one that is the most important and the one that goes through all of our interactions as we speak with you today. Cultural humility is an approach. It's a very personal approach that emphasizes our self-awareness and calls us to ask questions and to be good listeners and to be very aware of the biases that we all have. Always awareness is what engenders humility. Self-awareness engenders humility, and that's going to be the underlying pin for every interaction that we have. So when we were crafting our approach to Puerto Rico and the Virgin Islands, the most important piece when we were talking and when we talk about anything that we do with them is we're going to be there to ask questions, to listen, and to learn. It is very easy for us to come forth and say, well, we are the ones who bring the genetic services knowledge. We are the ones who have the access. We are the ones who fill in the blank. And therefore, we're going to teach. Absolutely not. There is no way that we can go with information if we don't seek to understand first. And that also ensures that any effort that we make within the communities of the Virgin Islands, Puerto Rico, or any other community that you work with, that it is sustainable and that we build lasting trust. So cultural humility above anything. Slide, please. Then we go to cultural dexterity. Cultural dexterity is one of these pieces that I see as more organizational. Radhika, thank you. Cultural humility equals self-awareness and willingness to learn. Thank you very much. So cultural dexterity, what happens when we are doing work within a community? We need to be able to adapt our behavior, our communication style to different cultural contexts. This includes being able to understand and navigate difference in communication styles and nonverbal cues, understand social norms, and different cultural settings. So for example, how does that reflect our NYMAC's organizational cultural dexterity in the interactions with the Virgin Islands? So the people in the Virgin Islands, the leaders and the representatives that we work with, wear many hats. They have a lot of jobs. They're constantly in the move. Their time is constantly stretched. And it is very difficult to really pinpoint a time, let's say monthly or every 2 weeks. We said, oh, every Thursday, we're going to have a conference call at 3 o'clock. Or every quarter, we're going to have, which we'll have a team meeting for the Virgin Islands. Well, that doesn't really work very well. If we're working with 15 to 20 people, all of whom wear several hats and all of whom have schedules that are stretched thin, we know that not everyone's going to be available at the time that we dispose of. So what we did and what NYMAC had the dexterity to understand and do is say, we're going to have several opportunities to have our quarterly meetings. So we put on several different dates and people come to the ones that match their schedule best. And sometimes we will have individual calls with people who really need, whose feedback we really need, and we change. That is an example of dexterity. Then we move on, next slide please, to cultural agility. So cultural agility is a broader concept. And by the way, all these concepts don't live in isolation from each other. They need each other to exist and to work together. So this cultural agility is both cultural dexterity and cultural intelligence. So it refers to our adaptability and how quick and effectively we make a move. For example, when we were in the Virgin Islands, we had several workshops, and in different islands, we would have a family workshop. When it came to our second family workshop, we had learned from the first one. And we learned that the format that we brought to our first family workshop was not very effective or it was effective, but it was effective in a different way. We wanted people to be able to talk. So what we did in this one is we changed the seats in a U formation so people would be able to have a more intimate conversation. And also we realized, Jermaine is here, that the leader of the Sickle Cell Foundation in the Virgin Islands was with us, and she was an incredible presenter. And so we said, Jermaine offered herself to present. And we heard her present, and it was an amazing way. We learned from the way that she presented. And we also were able to move on the spot, change the format of our workshop. We were agile, but why? The organization allowed us to do that, right? The organization boils down to individuals, Alissa, myself, Radhika, Cheyla, all of us were there, and we all had to come together and allow for this to happen. Thank you. Next slide. So when we bring it all together, all these, as I said, all these concepts don't exist independently of each other. So what we're going to do is now we're going to listen to Enrique, to Cheyla, and Alissa. Tell us about how they experienced these visits to both Puerto Rico and the Virgin Islands. And we hope, and I hope, that you'll be able to identify some of these concepts in their stories. And before we go there, though, thank you for that, Alissa. Before we go there, we're going to go to another Mentimeter activity. So, which of these concepts resonates most with you and why? If you can please write a short response in the Mentimeter. Which of these concepts resonates with you the most and why? Short response. Give you a reminder, we're talking about cultural competence, cultural humility, cultural dexterity, and agility. The last two we see as organizational grade. Cultural humility. Yes, cultural humility, dexterity, and agility. Cultural dexterity, cultural humility again. Many people with cultural humility, cultural agility, dexterity, humility. Oh, look at that. More dexterity. I don't know it all, and my culture, and not everyone's culture. Cultural agility, reminder approach with curiosity and not assumptions. That's right. Competence, I can prepare appropriate educational materials. Very good. Cultural humility again, willingness to learn and open-mindedness. I never put these two words together, cultural and humility. That's very interesting. Agility, I've been doing it my whole life. That is great. I would love to talk with you later, because it seems humility that one can most practice most directly. Competence, openness to learn. Humility is so important. Know what I don't know. Exactly. Very good. Having that space to open up and know what we don't know. Cultural, realizing that we have much to learn from each other and to not make assumptions. Exactly. Exactly. And it's that learning. So it's interesting that, cultural humility is really the underpinning notion here. And it's what it's coming out for you. So now I'm going to hand it off to Enrique to tell him, for you to tell everybody your story.
Okay, so before we do that, though, I'm just going to give a quick poll to everyone. So thank you, Isabel, for giving us all of that background information. But this is just going to be a quick, like 20, 30-second poll about some options and just things or families' beliefs about what makes a person more likely to like catch a cold or a virus. And if you have any other ideas, just please share in the chat. But it should just be pretty quick.
So that poll is up, Enrique, and some answers are coming in.
Okay, so we can see the results then.
You'll see your results in a moment. This is a really, people are into this poll. Let me tell you that I'm watching the numbers just fly up. So if I display the results, it ends people's ability to answer the poll. So I'm gonna give them a hot second here. You've got about half the people participating. I think you crowdsourced these. Do you want to guess which one is coming in most popular for this poll?
Mm-hmm.
We got a strong lead and a strong second here.
Okay, so we can see the
third.
So we can see the results then.
Okay, all right, everyone, here you go.
So yeah, I've definitely been told some of the most common ones here: going out in the cold with wet hair, the rain got you sick, taking a baby outside with no socks on. So I've personally been told a few of these, and then I also Googled some and asked some friends, but it's always interesting to see what other people always have to say as well. And so going on to the next slide, there's a reason why we asked this poll. And so the reason why we asked this is that we know that beliefs like this and expectations about health, illness, and genetics, they can heavily influence medical interactions, and we organize these culturally. So culture helps us construct this framework of ideas about illness, health, and how it causes it, how it's cured, how it's treated, and who should even be involved in that process. Exposure to this cultural framework happens very early in life. And so we're told by our relatives, by individuals, what to do when we're sick, why we became sick. And so as we grow, it develops a profound effect on how we receive the information that's provided to us and the usefulness of that information. And adding on more layers to it, we're a part of a multicultural society. We're exposed to so many competing cultural models of health, and someone may incorporate one or more of these cultural models into their own. And so when we think about different cultures in a Western industrialized society like the US, we typically see disease as having a scientific explanation, using technology and drugs to treat disease, whereas in other societies, may believe that a disease is the result of some type of non-scientific phenomena and use non-Western remedies, such as prayer, spiritual intervention, natural remedies. And so it's important to take that into account, because cultural issues play a major role in patient compliance then. And some individuals may choose to do one method or the other, or a combination of more than one. Then we think about stigma and attitudes, where stigma can come from both ends, right? So stigma from the patient to the provider, but also from the provider to the patient. The patient may not think that the provider understands where they're coming from, or the provider may have some unconscious bias about what the patient is going to even decide. And so someone from a different culture might come into a session with a preconceived notion of what their provider has to say or what the patient has to provide in regards to their health. And acknowledging this is always important to reduce that unconscious bias. When we think about the roles of family, religion, and even worldviews, how some individuals may not make decisions alone or may defer them to someone else entirely, how individuals may not choose to pursue certain types of testing or medical interventions due to their religious beliefs. And this all gets encompassed into this framework, whether someone comes from an individualist society, a collectivistic society, and it affects how they interpret and behave in all of these events. So lastly, for the specific cultural considerations, then, we think about the marital and kind of reproductive decision-making aspects of this as well. If we come from a different culture, we're going to have different views on all of these. And so this can come in the form of arranged marriages. This can come in the form of what I mentioned before about deferring decisions to someone else entirely, like a partner, a head of household, extended family members, a parent. And it can also come in the form of specific dietary restrictions. Some individuals are kosher, some are halal, some are vegetarian, some are vegan, and all of these are taken into consideration when we provide all of these medical interactions. And so the bottom line is that cultural differences, they impact our attitudes about medical care and how individuals understand and cope with illness, diagnosis, with treatment, and individuals and their families. They have this cultural framework that relates to their health and illness, how they report their symptoms, how healthcare is delivered, the beliefs on those treatments and medications. And cultural framework also influences many other things: the roles and expectations a patient may have, bereavement patterns, gender and family roles, and obviously their decision-making as well. So when we go to the next slide, we dive a little bit into more detail on what's actually unique about genetics appointments that might highlight these cultural differences. And so we know that in a genetic counseling appointment, this may vary significantly from an appointment with another healthcare professional. In a genetic counseling appointment, we focus on facilitating autonomous decision-making. We strive to be non-directive, trying to allow the patient to make the best decision possible for them. Other cultures, however, may be more directive, and medical professionals are expected to tell the patient what to do. And in the context of a genetic counseling session, this can be interpreted as uncertainty or lack of authority if someone doesn't provide that directiveness. When we think about encouraging conversation, we try to give patients real choices about their decision-making. If they desire to pursue testing for themselves or their children, if they desire to undergo prenatal diagnostic testing or not. We think about the familial nature of genetic disorders, how it can affect other family members and other generations and not just the patient. And so it's important to always know about this extensive family history and explain why it's relevant and not an intrusion in someone's life or their family's lives. We think about the concepts of disease and how they can vary by culture. Hereditary diseases sometimes may have shame attached to it. For example, someone may believe that an ancestor did something and now a family member is cursed, or through some way via karma. And so when we're explaining and discussing these genetic conditions or disorders, it's important to assimilate all of that understanding into how we explain it, because it can definitely make an impact on how patients or individuals perceive that information. And when we think about most genetic diseases, we know that they're not curable. We can treat the symptoms, we can provide preventative measures, but we can't provide a cure. And so sometimes there is some difficulty understanding the value of diagnosing a genetic condition if nothing at the end of the day can be done to cure the condition. And this, taken all into account, it just kind of highlights all of these differences. But I'm going to give it to my colleague Cheyla now to kind of expand a little bit more about what we can do to give genetic services more culturally adaptable responses.
Thank you. Making sure I'm unmuted. Thank you, Enrique. So let's talk about how genetic services can become more culturally adaptable. Here we've highlighted 4 separate ways that this could be done, but I just want to say there's many more outside of this. So first, diversifying the workforce. This has something that's been highlighted for many decades in genetics, but many of our professional genetic organizations are making efforts to recruit and retain diverse talent, with new organizations being created specifically to target certain populations with unique challenges and barriers to entering the genetics workforce, and working to alleviate some of those barriers. Like, just as an example, the Minority Genetics Professional Network was developed to provide resources for minority genetics professionals, connect them with each other, and work on kind of putting efforts forward to diversify, as well as Golden being an organization that works with prospective genetic counseling students who are come from HBCU. So that specifically focuses on Black prospective genetics, genetic counseling students. And there's also specific scholarships that have been created to alleviate barriers to getting into genetic counseling programs and being able to get that education, such as the Warren Alpert Foundation Scholarship, which aims to increase diversity in genetic counseling by providing full scholarships and living expenses for students from underrepresented backgrounds. Structural and organizational changes. Professional organizations, again, are identifying the need to adapt care and make it more culturally tailored, in creating and utilizing the resources necessary to execute these adaptations. National and state healthcare systems and hospitals are also creating culturally adapted service delivery models, because we recognize the need. Different states, territories, populations, whether that will be urban or rural, need to receive care in ways that are equitable to them, recognizing that it's not a one-size-fits-all model. Experience, exposure, and training for providers with patients from diverse communities. This one's acknowledging the importance of having experience working with the populations that you are going to serve or that you might serve throughout your career. It's important to gain this experience and exposure throughout one's training, just as important as it is to learn the information and skills you need to sit for a board exam or to graduate from a training program. This needs to be included throughout a person's training. And then lastly, education on cultural dexterity. As we heard from Maria earlier, because cultural dexterity allows students and professionals to have the ability to adapt their approach to the population they are serving. And I think that really sums up all of these points really nicely. And again, there are many ways that there are many ways to make services more culturally adaptive, but this is only the tip of the iceberg. So some examples of cultural competency efforts are proposed by the Genetic Counseling Training Cultural Competencies are communication, tailoring communication to specific individuals and audiences. And that means using culturally relevant terminology, considering health literacy, considering access to resources, et cetera. Health systems, evaluating the impact of healthcare and medical research inequities, disparities, and critical historical and ongoing events that affect diverse client populations and their interactions in our field. And then lastly, looking at professional identity. This is exhibiting culturally responsive behaviors that promote inclusive, just, equitable, and safe environment for all individuals and communities. And I think that's a particularly important point, because it's one thing to make things more equitable, culturally relevant, but it needs to be an environment that is promoting inclusivity. Not just like, look what we did for you, here it is, but actually making people feel cared about and included in these services. Next slide. So there are changes in training of healthcare providers. So these conversations began to have a great uptick and with the events in 2020, and implementation and training programs have begun, but it's important that the momentum is not lost. There's currently an increase in student research projects, publications, conferences, et cetera, that are keeping these conversations going. And through these things, providing ideas, resources, and proposed methods of implementation for training programs and professionals currently in practice but there's still a lot of work to be done. So the importance to support our colleagues doing this work is paramount. Next slide. So now we want to take a few minutes to discuss some of the new language that we've learned thus far and reflect on some of our past healthcare experiences through the lens of cultural dexterity, humility, and agility. So we're going to go into breakout rooms shortly, but first, let's take 30 seconds to think about a time where you felt more cultural dexterity could have been demonstrated and what could have been done differently. So I'm going to have a timer put up on the screen to give us 30 seconds to think about, and then we'll go ahead and go into the breakout rooms. Okay, so we're going to spend about 6 minutes or so in the breakout rooms and then come back here.
All right, I'm going to invite everyone to those rooms now, and we will see you back here in 6 minutes.
All right. For those of you that stayed here in the main session and weren't able to join breakout rooms for whatever reason, we are going to offer an opportunity for you to use the Mentimeter, so that link in the chat, to share your own experience. So check out the chat for the link, and people can share with each other healthcare related experience where more dexterity, humility, or agility could have been demonstrated around culture. So check that out, and we will share the responses.
Secrets you can't tell. Mix a special brew with fire and
We have some really great responses and stories that you guys have shared, and I think a lot of them are things that other people can relate to about assumptions that people make about grouping people together because of what they look like or what we assume about them. So I really appreciate that. In just a moment, the people that were in the breakout rooms are going to come back and join us. And at that point, we are going to get into a little bit more personal storytelling. So thanks for sharing your stories. All right. Welcome back to everybody. Great. I see people coming back. Perfect. Okay. So thank you so much for your thoughts and your stories about things that you have experienced yourself or seen experience. We're hearing a lot of great conversations. We're going to turn now to look at some of our own personal reflections about this work, and in shaping our experiences and ideas, we've really thought about this in terms of how each of us went into the work and then what happened during the work, and finally what we each have learned so far. We're most definitely not saying that we are experts or that we did everything the right way. We're just sharing our personal experiences and what helped us. So for me, I came to this work with certain assumptions and certain existing ways of doing my work. For all of us, we are striving to be really honest and vulnerable in that honesty about our processes and progress. So we really ask for your grace as we make some of these internal processes more public with you. So for me, I went in assuming that the communities in Puerto Rico and the Virgin Islands wanted and needed our help, assuming there were gaps in local knowledge and support, and assuming that we had a lot to share and teach. I went in with existing collaboration strategies, which typically meant I was reaching out to new people that I wanted to know, existing communication strategies, relying really heavily on email and Zoom, existing management strategies, which typically meant really long-term plans with very little change, and existing educational resources, models of genetic services, and existing budgets. When I think about what happened, I learned in the spring of 2020 that Puerto Rico and the Virgin Islands would become part of the NYMAC region. So the first thing I did was sought out and hired people who had experience in collaborating with partners in the territories, and began building relationships and identifying key stakeholders and some of those people you can see in those pictures in the corner. To add more insight to my process and those of our organization at NYMAC, when I first learned of the change, I was pretty intimidated, but also really excited and definitely knew we'd need to make some changes. One of the first things I did was ask for help and start shifting our budget to make room for liaisons and local partners, and I also asked for more funding. I started at this point asking questions in an effort to learn from others who had done this type of work before about what succeeded or what had challenged them in the work. As we began building relationships, we identified some great community champions. We asked a lot of questions about who in the community needed to have a role in the work that we were doing, and we started to hear about and learn about some of the key competing priorities people were experiencing, including at that time in June of 2020, the height of the COVID pandemic, and continued recovery from recent hurricanes, and those were really important. So as we moved forward, we slowly built our network by building trust. We brought people together to work toward consensus on local priorities, and we adapted goals and methods over time to meet local needs. To add more insight here for me and for NYMAC, in building our network, we sought out as many new connections and soon saw that earning community trust takes time and consistent effort. That trust does come faster if you have the trust of someone else in the community, And we saw, of course, that historical experiences that the community has had influence their willingness to trust us. When in bringing people together, I knew we had to be mindful to financially support people's time and effort. I asked as many questions as people were willing to answer and started learning a lot about other efforts and programs that had tried to collaborate in the territories in the past. We started to build some understanding of local systems and see clearly the incredible strengths of the people we were working with. I knew pretty early on it was going to be really, really important for us to find a way to meet and work in person. With our goals, we definitely had to reshape our plans as we worked and learned. One thing that was really clear is that we had to change the way we were used to engaging with and communicating with people based on our work on the mainland, and that email and Zoom just were not going to be the best fit. We asked about and listened to what local priorities were around genetics and asked about strategies that have been successful before. As we moved into an implementation state, we planned and implemented our projects together. We tried to listen and learn while we were collaborating and check in regularly with our partners about how things were going and keep adapting. And as we did those things, what was happening for me is that as we planned, I needed to keep adapting our organization's budget. We needed to support local leaders. We needed to go into the community in person. Because we had relationships, we were able to have our network help us disseminate the things that we were working on. And always during the work, I'm looking out for other grants or related projects that could help support our efforts. As we collaborated more, I tried to be really observant, but definitely not overgeneralize. I think we started to build some cultural competency about local systems, customs, traditions, and norms. I kept asking and still keep asking what the barriers and priorities are and how they've overcome similar issues before. In terms of checking in with partners, we did plan for evaluation of both our process and our outcomes from the beginning. And one of the things we do is to assess the relationships within each territory team. As we learn, we make needed changes and try to share our successes and challenges, just like we're doing right now today. And we also try to identify and support people doing related work. So if you're listening right now and you're working on things that are related to what we're doing in the territories, please reach out and let us know. We've identified a lot of other programs that are doing things that are somehow related, and it can be really, really helpful for us all to work together. So in retrospect, when I look back now on the things that I have learned that I think could be useful to other people who are doing collaborative work with communities, first, that there's incredible local knowledge and that we have a lot to learn from the creative solutions people have come up with. Cheyla mentioned this group of women that we met with in St. Croix before. They work in the newborn screening and the WIC program and early child health. They were amazing and taught us so many incredible things that we didn't know before. So we thank them so much. Again, we saw that adapting communication was necessary when we started using WhatsApp, which I never used before. The work requires a lot of organizational investment and adequate staff. So we take pretty big groups with us when we travel. You could see a picture of us there in St. Croix. And those things cost money. So you just really need to be cognizant of how to shift things around to make that happen. Sometimes stakeholders are really happy with the systems they already have and they're working just fine. And again, those competing priorities are really important to be aware of. We see that engaging liaisons and local partners and champions were absolutely vital. And we've talked about Jermaine a couple times, but I know she's here and her card is there in the corner. And people like Rosani, who you met this morning. And there's also important cultural differences within the communities on the islands, which I know Cheyla is going to talk about. We needed to learn a lot about how healthcare systems differ. So the newborn screening system, maternal child health, Medicaid, they're definitely related to the way that we understand them on the mainland, but we needed to understand how they really work there. And then again, that baseline plans need to be adaptable and they need to change. And lastly, that the goals and methods of the way we deliver genetic services on the mainland may not meet the needs of the territory communities. And that really leads me to my last point. Because a good amount of our work in both Puerto Rico and the Virgin Islands involved discussing the possibility of having genetic counseling more available to those communities where it's not currently very available, I felt like the process of thinking about adapting American mainland style genetic counseling to a new culture really was an exercise in cultural dexterity. I do want to acknowledge that many other people and organizations have done this work before and they've written about it. And you can see some of the references on the bottom of the slide there. But for me, it really felt like discussing the profession and the goals of genetic counseling and providing counseling services in cultures where it isn't an established part of the system allows for an outside perspective and observations about our job that we normally might not get. And that helped us really restate one of our goals to promoting genetic counseling services that address the historical, cultural, and ethnic needs and expectations of the individuals and communities they serve. And we can thank our colleague, John Weil, who shared that particular phrasing with us. And with that, I'm going to welcome back Maria for us to do a little thinking together about this with another Mentimeter activity.
Wonderful. Thank you, Alissa. Okay, thank you for sharing your perspective. That was great. So let's think about how does your organization support the work that you need to do with underserved populations or communities? And if you don't feel that your organization is supporting you, tell us how you would like to be supported. I want to remind you that all your feedback is completely anonymous. We really want to hear from everyone. We all know that you want to do the best you can to work with underserved populations and communities. And so tell us all about it, please. We're going to have 2 minutes for this.
I'll start sharing responses as they come in. Maria, you have big questions, so people will take a moment.
Thank you. Our hospital is a nonprofit and offers charity care to uninsured parents. Great. Grants. Excellent. We'd like to have more access to translation services for patient materials. Yep. Funding for translation. Ready access to interpreters. Oh, very important. Yes. Employed me, added another genetics provider. Excellent. Lots of seminars and workshops. Transportation funding. Very important. My organization provides no avenue for obtaining, providing documents in languages other than English. Oh, wow. Our company works to ensure technology is accessible. Financial assistance. We need better support for interpreter services. Current patients are in charge of arranging. Oh, no. Let's talk. Whoever you are, send me a private message. And the instructors are provided in English only. Providers from diverse backgrounds. Yes. I would like to see an easy interpreter service at my company. Funding sources should have community outreach, both phone and video interpreter services available. Diversity, equity, and inclusion initiatives. Yes. I would like to see more dedicated time. That doesn't require raising money right away, just blocking time where your funds go. Increase in telemedicine. These are great. We love more work with CBOs. Excellent. These are really great. I would like to see more employees at my company who are not wealthy white males, more diversity. And yeah, I would love to see more medical coverage for medications and treatments. La oportunidad de realizar niveles de fenilanina en Puerto Rico. So Vilma, okay. Financial assistance. I would love to see more Medicaid coverage for medications and treatments. After a lot of time and effort, my part, I was able to make a couple of forms more inclusive. Very good. So you're also using your time to do that. Contacts with underserved. We need to make expanded screening the norm across all populations. Excellent. And I see that some of you have mentioned some pretty basic items that we thought were no longer the case, which is interpreting that is not available. That is pretty surprising, very surprising. Thank you all. Thank you very much for that. Please do reach out at the end if you would like help with any of these. And now we will thank you, Radhika. There is my email. Now I will hand it off to Cheyla so she can continue telling us about her experience in the Virgin Islands.
Thank you, Maria. So much of what I learned during our visit to the VI was shared by Alissa. So I'm just going to share a little bit of my experience and just say that a lot of my experience, or the way that I went in looking at a lot of things, was colored by my identity as a Black woman growing up in the United States. So I joined NYMAC in 2021, and I spent the entirety of the year of 2022, getting to know NYMAC goals overall and what our goals were in the Virgin Islands. I went into our visit to the US Virgin Islands in January of 2023 as a clean slate, just ready to get my feet on the ground, observe, and learn from what our Zoom meetings were covering in real living color. Though I was raised in a different culture than that of the US Virgin Islands, I had a shared ancestral background and experience with being Black as many of the people in the Virgin Islands. So I would be lying if I said that this wasn't in the forefront of my mind during our visit there. I wanted to focus on learning about who the people of the US Virgin Islands were and about the community stakeholders and how that would tie into the work that we aim to do. I wanted to hear everything about the perspectives and the needs of the people there, because many of our conversations amongst our NYMAC teams could very well be assumptions. And I wanted to hear from the community what the reality actually was. And speaking of assumptions, I was expecting to learn that there may be gaps in genetic knowledge, a lack of interest in genetics, and a lack of trust. You'll find out later in my part of the presentation that that was absolutely not the case. And lastly, I was ready to build trusting relationships with them through our time spent together. Next slide. So what happened? And if you could click one more time, Alissa. So there was a foundation of trust built from the time spent during team dinners and meetings with many of the stakeholders there. There were enlightening and productive conversations with concrete take-home messages and action items that were identified. And through these meetings, we were able to learn about the triumphs, the challenges, and we're able to develop a needs assessment in next steps. So we really learned what the stakeholders in the community were doing really well, it was working well with them, and then talk about the challenges. We developed connection with other collaborators on and off island. So through meeting new people while we were actually in the Virgin Islands, we were able to say, oh, we know someone in the continental US that also does something similar. Maybe we can connect you with them and we can continue this work and push it forward. And lastly, we were able to expand our network through these meetings, events, and presentations. So particularly for me, during the Grand Rounds presentation that we had on St. Thomas, we were able to meet many providers, health commissioners, nurses, so many people in the community that we can connect with to talk about how we can use our resources and we can use the resources on the Virgin Islands to kind of push these things forward. And on the next slide, I have some pictures that kind of demonstrate the things that we did while we were there. We met with legislators on St. Thomas to talk about the things that we have learned from the stakeholders, kayaking with the children at Family Fun Day on St. Croix, parents at the Family Fun Day, a picture of our team after a parent training, and then a picture of all of us along with the health commissioner and the dean of the School of Education and the director of the maternal and child health while we were in St. Thomas. And then my next slide. So what I learned so much that I couldn't even really encompass on this slide. But while the VI has their own unique challenges when it comes to the healthcare system, there are many challenges that are not too much different from those experienced by people who look like them, Black people in the continental US. Some parents even expressed to us that they face prejudices when taking their children to the ER for sickle cell pain crises, which is something that is also a big issue on the mainland. And I learned that there are still barriers when it comes to providers in their own native land that don't look like them. That's similar to what we experience here in the mainland. I observed cultural differences in communication and service delivery methods. This is something that Alissa just touched on. And from what I can tell, island life is much more personal and closer knit than we tend to be here on the mainland. And communication doesn't always happen via email or Zoom meetings. There are other methods such as texting, in-person visits. If you haven't been able to get in touch with someone, it's a cultural thing to just pop up at their house or at their office. And even service delivery methods such as telemedicine. I think a lot of the providers on the island can acknowledge the benefits of telemedicine, but many providers express that they prefer to be able to see and touch their patients, and that the more personal experience that the in-person medical visits allow is something that they prefer over telemedicine. And so this really got me thinking that while we like to implement telemedicine for genetic services, it would also benefit to have a provider who could do both telehealth and in-person visits. I noticed that the effect of frequent environmental emergencies can disrupt healthcare delivery and systems as they have organized it. So we might have went into this thinking that certain genetic education needs or genetic services were not a priority for the people in the Virgin Islands, but there's really an effect of competing priorities for both the needs identified by the government and also by the people who are affected. The frequent emergencies and the hurricanes can have an effect on the accessibility or even the efficiency of some of these medical services. And so when one issue is being focused on and then there's a hurricane that comes, the priority shifts to repair those things, and some other important things may slip further down the priority list. I felt a strong sense of resilience and community during my time there. Again, as a Black person, I know inherently that Black and Brown people are extraordinarily resilient, but I felt very strongly during my time in the Virgin Islands that despite everything that they've experienced, especially in the last few years, they do not let their determination to get patients and families what they need, regardless of the circumstances that present themselves. They don't let that fall to the wayside. The resilience is what our VI team can draw upon to push the stakeholders' work forward. And then lastly, one very important point that I learned during my time in the VI is that it is not a monolith. It's the US Virgin Islands is composed of St. Croix, St. Thomas, and St. John. And there are cultural nuances that differ between each of those islands. Though there are many similarities, each island differs in their needs, their priorities, and their challenges. And it's really important that we build a team of stakeholders from all of these areas of the territory and hear each perspective and experience. And with that, I'll turn it over to Enrique.
Thank you, Cheyla, for sharing your experience. So I'm gonna do the same now. When I went into this, I was definitely a little nervous. I had finished grad school a few months before that, and I had just starting this consultant job with NYMAC. And so I wasn't expecting to go to Puerto Rico in like 3 or 4 months after I started, but that's kind of how it happened. And I'm very grateful for it. It was just something I wasn't expecting, but it turned out to be something really nice. When I think also about the nervousness of it, it was the fact that I didn't know too much about Puerto Rico, or I knew little of it. I knew it would resemble some of my cultural aspects in where I was raised, in my current position. And I know there would also be differences as well. So just for some context, I was born in Brazil and I moved around a lot growing up. So I lived a decent amount of my life in Brazil, in Spain, and in the US. So I kind of have a different approach to when I think about all of these things. And so that added on to, I didn't know what to expect. Was it a combination of one thing, a combination of another? Was it something something completely different? And when I wanted to go into it, I wanted to understand how we could benefit Puerto Ricans on the island. And so we wanted to listen to them, see what would work for them, see what hasn't worked for them. And we were curious about the volume of the genetic testing and services on the island, where we initially went into a focus on cancer, thinking that would be kind of like the logical realm. A lot of people do cancer testing, that's a need. And then we ended up focusing more on pediatrics just because of all of the connections that we made, and it made it more easily accessible for us to do it on that end. And when I was going into Puerto Rico, I was definitely expecting some hesitancy just from the stakeholders because we're outsiders, right? So when someone is coming on the outside looking in, we're sometimes thought to think, okay, we have to put our best foot forward. We can't let them show anything's bad, nothing like that. And so it's hard to envision when we see these outside groups coming in, because we don't have that perspective of a lot of other individuals coming in where we are and giving those same type of services. So I was a little concerned about that. But on the next slide, with what actually happened, we saw that the stakeholders were actually thrilled to have us, and they met us honestly with arms wide open. And it's just kind of that Puerto Rican culture that is amazing and that I appreciate more and more every day, with all of the connections we made, all of the stakeholders that we've met, and it just made our collaboration even stronger on the island. We started understanding how genetic services and testing are actually done on the island, how a lot of the referrals are due to autism, how there are public versus private geneticists, and there are other interested providers that want to do genetic testing and counseling, but have no avenue as of right now. And so trying to work with that. We saw firsthand how hard patient advocacy organizations and providers work. We know that they fight for legislation, services, they advocate for their families, for other individuals, providers, especially in Puerto Rico, where there's an increased prevalence of Hermansky-Pudlak. Individuals and providers volunteer their own time and see multiple patients in a day to provide services free of charge for those individuals. And so you can just see how hard individuals on the island work. And when we did these events, what happened was we made a lot of these relationships on the fly. We met people at events. We made these important connections where we were doing family workshops, and we saw someone that was very interested in our work that would be very beneficial to be on the team. And so we invited them right then and there to be on the team, and they've been interactive. They've been a part of our team, and they've even asked us to do other work for their organization or for other parts of the island. And so it just shows how these relationships are built at any point in time. And we collaborate with multiple individuals to form this comprehensive network. And so it allows many of these individuals now, family advocates, providers that wouldn't necessarily have been interacting beforehand, to now be able to meet one another and for them to just have a stronger relationship on the island and provide even these stronger services to everyone on the island. And in the next slide, we see just some pictures for some of the dinners that we had, some of the students from Colombia that went, some of the lectures that we had given, and the talks that we have received. And so it was a combination of many different things that made these trips very successful. And at the end, what I learned was something that one of my NYMAC colleagues has said, is to always be nimble and to be willing to change. And so a lot of these decisions that we make on the trips are sometimes just down to the wire, honestly. Sometimes something completely changes, we add something, we change something completely differently. And so it's important to always just be on your toes when doing this type of work, because something can just change at a moment's notice. We learn more about the culture and genetic services on the island, the importance of building these connections, and how we can accomplish the mutual goals, not just us telling individuals what to do, but working in conjunction with all of the stakeholders and the stakeholders within themselves to provide this, what we hope to do is this self-sustaining model. And in addition, to just be authentic in the way that we approach and collaborate with local people to create strong systems of care. We practice that cultural dexterity, the cultural humility. We don't know at the end of the day what it's like to be in that location, in that population. And so it's always good to keep an open mind when we go into a different setting, and we're always aware of that. And lastly, something that always astounds me is the resilience and the fortitude of the Puerto Ricans on the island, and how I see similarities within the continental US. So I practice in a hospital that's mainly like over 50% Spanish speaking. So I see a lot of the similarities in culture and the resilience and the fortitude individuals have. But it's just astounding to always see that, like, there's always just this extra bit of fight that individuals have to be able to do what they want to do. And that's kind of just my experience from what this was. And then transitioning to this activity, we want to think of, have everyone think about their own background. So whether it be similar or different? How does your own culture or background enrich your experiences with others of the similar culture or background? Or how does your own culture or background challenge your experiences with others of a different culture or background? And we put 2 separate links in the chat. One for the similarities, one for the differences. And so if everyone could kind of just respond there, we can see it on the screen in a bit.
Yes, Enrique, as they come in, I'm going to first show the similar. We'll get a little bit of seeing those. And then when on your cue, or just when it seems natural, I can toggle and show you the results to the different. I just toggle them back and forth. They're just slowly coming in here.
Okay, perfect. Thank you. Do we have some responses?
We do have some responses. So Enrique, just working on having these things open double at the time seems to have like overwhelmed Mentimeter. We're apparently trying to do something that it doesn't usually want us to do. So here we go. All right, I'm going to show you similars right here.
Thank you.
We got them. We got lots of great answers. Here you go.
Okay. Love being multicultural. It helps me understand many other cultures and connect with them in a personal level. I also have a non-judgment status towards how others feel. That's always good to have. I'm able to understand where some of the sticking points might be, including apprehension about interacting with healthcare and a readiness to speak more conversational. Very important too. Thanks for sharing.
Okay, want to see some of the answers to the other one? And here you go with different.
Not fully understanding the rare genetic concerns in their community. So this is the differences. Challenges me to become more sensitive to the fact that they may have cultural differences. Concerns that others of a different culture may feel not seen, definitely. I was raised in a very small community where everyone was from the same or similar ethnicity. It was not until college that I met people from different backgrounds. It was very eye-opening. Yeah, so all of these are excellent points. From the similarities, from the differences, we can all resonate. I think everyone in this conference could resonate with at least one of these options that are mentioned. And so now we're just going to pass on to the next individual who's going to talk, which is Amanda, and she's going to share her experience then and her story.
Okay.
I'm glad to be with everybody today. I'm going to share a bit about my story. I am a genetic counselor at Columbia University, New York Presbyterian Hospital, and that's located in Northern Manhattan. I'm also the program director at the Columbia University Genetic Counseling Graduate Program. And my story about how I went into this work collaborating with NYMAC in Puerto Rico specifically actually starts back a little bit further. I suppose it starts all the way back in about 1974. when my brother was born. So he's pictured here in the blue shirt on the left. And maybe even 15 years ago when he married my sister-in-law, who is from Puerto Rico. She's pictured on the right. And then my amazing nephew pictured in the center here. So this is my family that lives in Puerto Rico, right outside of San Juan. And I began in conversation with them some time ago about the access to genetic counseling services in Puerto Rico, since I was practicing as a genetic counselor. And when my sister-in-law was pregnant with my nephew, we spoke a lot about it. I sort of became aware of the fact that there really wasn't as much access as I had here in the mainland US. And so that really sort of was probably the very seed of my interest in being committed to particularly expanding access to genetic counseling in Puerto Rico. Alissa, I think you might be advancing my slides if you don't mind. Thank you. So there were several other next steps. The first was initiation of the Columbia University Genetic Counseling Graduate Program, again in Northern Manhattan. Following that, I think I have another animation, was really an understanding of Columbia's commitment to the local community where our campus is located, again in Washington Heights in Northern Manhattan. And following that and building upon that was really an understanding of the racial and ethnic composition of the community here. So our local community is predominantly Hispanic. And as I was designing the graduate program here, really recognizing that the students that we're going to be training and being educated in our program, we're going to have a lot of exposure to providing services for people who identify as Hispanic and Spanish speaking. And so the next step really for me was thinking about how to incorporate this into graduate education within our program here. And through a series of connections, I ended up identifying an opportunity for the students in our very first class in the winter of 2019-2020 to be able to go to Puerto Rico for about 6 days for a Spanish immersion program. So really being able to kind of kick off Spanish language classes, no matter what level people came in at. And we had some focus on genetic counseling and medical Spanish as well that week. But before we left, we had the opportunity to actually listen to a talk that was later turned into a publication, which is listed here, from people that were in the process of taking care of people in Puerto Rico and in the mainland US who are Puerto Rican, and really thinking a lot before we visited Puerto Rico about some of the historical perspectives and health status, as well as healthcare access for people living in Puerto Rico at the time. And so all of this culminated in, this is a picture of our very first class of students at Columbia, arriving in, if anyone recognizes El Market and in the Puerto Rico San Juan airport. And we spent the rest of the week, I think, Alissa, there's probably another animation here. We spent the rest of the week having about 4 hours of Spanish classes a day, doing community service in the local community where we were staying, and engaging in cultural, historical, and geographical learning as well, really coming to understand more about living life in Puerto Rico as we thought about the interconnections between what we were learning and laying the groundwork for hopefully at some point bringing genetic counseling services in a more robust way to the island. As well, while we were here, I think this is probably another piece of animation, we got to be present for the 2020 Puerto Rico earthquake sequence, specifically the 3 largest earthquakes in the first week of January. I think there's probably one more animation here. So this was another piece of, I think Cheyla had mentioned previously, just starting to understand some of the geographical differences that are happening in some of the ways in which communities are navigating things other than thinking about genetic counseling services. So it was quite a learning experience to be present. Actually, the entire island lost power. I'm sure many of us that are on the Zoom today were present for this. And so again, it was another piece of learning while we were present on the island there the first time. So from here, when we returned to mainland US, we started thinking about how to help students continue to foster their use of Spanish language skills and thinking about how that would integrate in a way to help genetic counselors and burgeoning genetic counselors really to be able to better provide services for people who are Spanish speaking. And so a couple of things stemmed from here. The first is that we started offering weekly Spanish classes on our campus, which were nicknamed Genomes While Eating, Genoma Mientras Coma. And this led to one of our students choosing to do her master's thesis looking at the utility of having limited Spanish proficiency in genetic counseling sessions when engaging with interpreters, and how that can help improve services for people who are Spanish speaking. We also, I think there's probably another piece here, got to participate in a national presentation at the NSGC meeting this last year related to Spanish language proficiency training within graduate programs in the mainland US. And then, as Alissa mentioned, about 3 or 4 months after we came back from our first trip to Puerto Rico, we were greeted with the COVID-19 pandemic. And that certainly put a hold on any future plans we had for returning to Puerto Rico and beginning to further relationships there. But fortunately, at about the same time, NYMAC became involved with Puerto Rico, which sort of picks up with where Alissa started us off a few minutes ago. And so we were very grateful here at Columbia to begin partnering and collaborating with NYMAC in helping to support the work that they had been planning to do in Puerto Rico as well. And I do want to say we continued with weekly Spanish classes. We engaged a local Spanish language instructor, and all of our students continue in weekly Spanish genetic counseling Spanish classes here. And so from there, the next part of what has happened is really 2 visits for Columbia students, myself and several Columbia students each time, in conjunction with NYMAC's visits to Puerto Rico in May of 2022 and most recently in March of 2023, which have both consisted of several days in clinic, getting to work with local providers in Puerto Rico, providing genetic counseling services and starting to get a feel for what that might be like and how to partner with local providers to help augment services for families and what types of things families would really benefit from. We've had opportunities to meet advocacy leads, again, continue to engage in cultural, historical, and geographical learning in the area. We've participated in several grand rounds and student co-education events. And we've been meeting with university leaders as well to explore the possibility of bringing genetic counseling education to Puerto Rico in an effort to help train local providers and people who are interested in providing services within Puerto Rico as well. And probably some of the highlights of our trip have been some of the family conferences. So in terms of what's been learned through these trips that we've taken and some of our engagement over the last few years, I wanted to start off sharing what some of the students have learned. Enrique and I are pictured here with several of our students that traveled with us last May. That working with patients in another language reminds me that it's more important how people feel when they're with me than exactly what I say. I really liked attending the conference that brought together medical providers and patients. It felt like medical providers were integrated into the community and there was a closeness, which I know several of us have spoken about experiencing in Puerto Rico and the Virgin Islands. Time feels a little different in Puerto Rico. I was more relaxed in clinic and I didn't feel like I had to rush. I was able to be more present and more in the moment with the patients I saw. I have skills and knowledge to offer that can help people even while I'm still in training. It was a huge confidence boost for many of our students, which certainly translates to better patient care. And I experienced a culture of being closer and warmer with patients than in the mainland states, and at the same time more concrete and direct. This will definitely impact how I practice. So I wanted to close by sharing some of what I personally have learned through this journey. The first is probably the most important, that I am always learning. This is probably not illustrated more effectively than with the actual hashtag for our genetic counseling graduate program, which is #alwayslearning. It's a little shot from our social media account here. The second key piece for me has been that intercultural immersion is a robust teaching and educational method, but it really does take work. This is the picture of the 8 students that traveled with me last month in March of 2023. And, sharing many of the things on the last slide that they learned, it really does take a lot of work to support this teaching method. I've learned as well quite vividly, I think several of us have spoken about this, that access looks different in Puerto Rico and services really need to reflect this. So this is technological differences in access, geographical differences, some cultural differences in terms of timing and scheduling, as well as access to health insurance and methods of being able to pay for genetic counseling and genetic services as well. I have definitely learned that I need to go be there. Relationships in Puerto Rico are built face to face, and it's really hard to understand the people that you're collaborating with without experiencing life and relationships in person there. And I wanted to highlight several of the universities that we are building collaborations with. And lastly, to support your team and build on each other's strengths. It truly does take a village. So I'm very grateful to be engaged with this work. I'm grateful to be working with the students here, the faculty here at Columbia, the faculty at the universities and health centers we're working with in Puerto Rico, and most definitely with NYMAC. I'll hand things back to Maria Isabel.
Great. Thank you very much, Amanda. We had an activity, but we're going to run right through that. And I'll start a little bit. So as we hear from everyone, really the biggest take-home point is remaining humble. So as we think about action planning for the future, slide please, let's talk about not just granting meaningful access. So we often think as healthcare providers and as families receiving access is, how are we going to make sure that we increase access to the services that we provide, or that we have access to the services that are available? But instead, what are we doing to understand the community that we are wishing to access? Let's think about it the other way around. How are we going to access the community to which we want to increase access? Slide, please. So this is a little bit of where I come in. People sometimes ask me, I've had the question in Puerto Rico and in the Virgin Islands, Maria, what do you do? Are you a geneticist? Are you a genetic counselor? No, I'm neither of those things. I know very little about genetics. I embarrass myself when I try, so I don't even try to talk about genetics. And Alissa shakes her head. So really what I do, I'm going to tell you what I do. So we've been listening about the clinics. We've been talking about the family workshops, talking about the people who we meet in the U.S. Virgin Islands and in Puerto Rico. Well, there is someone called a cultural liaison or a community liaison, and that's who I am. That is what I do. When Alissa found out that NYMAC was going to have Puerto Rico and the Virgin Islands, she tells me that she thought about calling me, and I was very thankful for that because I do have a lot of relationships, pre-existing relationships in both places. And I am very fortunate that I have been able to build trust with many of the systems in both territories. And so what does a community liaison do? So when you, as genetic counselor, geneticists, pharmacists, or in your space, whatever you do, you are doing your work. You're concentrating on the day-to-day providing services. Obviously, you're going to take all the principles that you learned about today, and you're going to bring them in the best way possible. But it takes a lot of background work. It takes a huge investment. When I am reaching out to and building relationships with the people in the Puerto Rico and the Virgin Islands, I'm building trust. That takes time. As Alissa will tell you, that takes a lot of time. I'm on the phone a lot. I don't, because of communication, as you have heard, is so different, and modalities, Zoom, as Alissa said, is not a thing, or we have conference calls or emails. No, I will be texting with someone from the Virgin Islands on a Sunday. And if someone from Puerto Rico would like to meet with me on Friday at 5 p.m., I will be available on Friday at 5 p.m. We have conversations that are not via the regular channels. And so here is where the dexterity and the agility of the organization, mainly Alissa, needs to be commended. Why? Because we do things in a very different way. If WhatsApp, as Alissa mentioned, had never been used before, that's one of our main ways to communicate. If that's what we do, then that is one of the main aspects of our communication. So while the community liaison is building those relationships in the background and building trust, we're also trying to enhance the bi-directional cultural understanding. So what I try to do is be able to empower both sides in order so that they can meet without me at some point, right? I'm not trying to work myself out of a job, but when the job is well done, there will be less and less of a need for that sort of mediation. And what else? We address community concerns. Sometimes the language, and I don't mean Spanish or English or patois or whatever it is, sometimes the intellectual language, the emotional language is different. And as a community liaison, I have a good understanding of what that is. Enrique was also mentioning when we were in Puerto Rico, we would move, we would shift activities in a minute. We would change how things would do based on community understanding of what we were doing. So we would be able to shift. This is what a community liaison do. Organizationally speaking, this is a decision that is a budgetary decision. It is a time decision and an organizational decision that NYMAC has made. And that is one of the reasons that the efforts have been sustainable and that the efforts have been welcome within the communities that we work in. Next, thank you. And so when you're thinking through your interactions, how do you give them space to teach you how to engage them effectively? Active listening without anticipating an answer. Pay attention to body language and how your interpretation of it might be culturally bound, and ask open-ended questions. Next one, please. And next one, next slide. Thank you. Remain non-judgmental. Same cultural humility. Instead of, oh, I can't believe they were late again. Instead, figure out where they were late again. Maybe it's a transportation issue. Someone in one of the activities said, figure out transportation for the appointments. You can find out a lot when having a non-judgmental attitude. And the next one, finally, humility. You knew this is how I would end this, is humility is at the top of every interaction that we have. That is the only piece that I will leave you with, and of course, dexterity, agility, and cultural competence, but be humble. Let's be humble in all of our interactions. Now we'll pass it on to Alissa.
Perfect. Thank you so much. So as we did when we started, we're just going to take a couple minutes to revisit these questions that we started with about cultural competence. So check out the links for the English and Spanish version in the chat. Give us 2 minutes of your time to reflect on how you feel about those things after our conversation today. And we appreciate your time in doing that.